The honourable member for Calgary-Nose Hill, followed by the member for Calgary Varsity.
Well, thank you, Mr. Speaker. I would like to make a few remarks regarding this debate about the H1N1 virus and about the plan to respond to the influenza outbreak. And I'm not going to partake in ascribing blame to this or that individual, whether they be elected officials, public health managers, or officials or workers in the healthcare system. I'll leave that criticism to members of the opposition parties or to the political pundits. At best, blaming others is a non-productive pursuit. At worst, it's political opportunism. Nor will I indulge in scaremongering. Instead, I'd like to try to put the present pandemic in some sort of perspective. Pandemic is a scary word, but according to the shorter Oxford Dictionary, it simply means a disease that's prevalent throughout a country, a continent, or a world. And diseases can be, as we know, serious, or they can be less serious. Historians will tell us that the influenza pandemic of 1917 was one of those that was very serious. It was responsible for the millions of deaths throughout the world, and medical science had no real answers to that pandemic. People lived in dread from the disease, as those around them succumbed to serious symptoms and often to death. In fact, at that time, we didn't even know what the structure of viruses was. We didn't have things like genetic decoding in those days. We didn't know the structure of viruses by electron microscopes. So, Mr. Speaker, we are truly fortunate to live in a country in this present day and age, like Canada, a developed country, and even more so to live in Alberta, where we have one of the finest healthcare systems in the world. Although, by the criticism of some of the opposition in this House, on an ongoing basis, one would wonder whether we had such a great healthcare system. Our healthcare system is one where every citizen has access to first-class, free, public-funded care. We lead the world in many areas of treatment. And unlike in 1917, it's a modern system where we have tools at our disposal to look at the structure and the genetic code of viruses, to learn about how they mutate and change, and about how the human body responds symptomatically to those different strains. But, Mr. Speaker, expectations must be tempered by the knowledge of what is possible, given the timelines and the resources available. In North America, Mr. Speaker, influenza usually affects people in the November to April period. We know that influenzas can be serious for certain people in our population, vulnerable to one strain or another, and not everyone is vulnerable to the same type of strain. As we become exposed to them, we develop immunities to similar strains. But to put things in perspective, every year in Canada, seasonal flu causes anywhere from 2,000 to 8,000 deaths. Every year, just to put it in perspective. Now, recognizing that it can be serious for some, for a number of years, healthcare providers and governments in Alberta and across Canada have instituted programs to vaccinate anyone who wants to receive seasonal influenza vaccine. The strains are targeted. Usually they include the 3 most common strains that are prevalent in the spring, and then they get to work and produce a vaccine for the fall. By taking the vaccine, our immune response is triggered and our bodies generate specific antibodies. This is not an exact science, however, because viruses mutate, they change their composition, and the antibodies produced inside our bodies become ineffective or less effective in attacking the viruses. Which brings me to the H1N1. The H1N1 strain of influenza was first reported in March, or according to some other authorities, as late as April of this year. Yes, March 2009. That's not even 8 months ago. In April 2009, Canada launched a public awareness campaign about the H1N1 virus. and the Government of Canada got to work on a response. It should be remembered, Mr. Speaker, that for most of us in the population, H1N1 will only bring on mild symptoms. However, it was recognized that H1N1 was one of the most widespread strains of influenza, and on June 11th, the World Health Organization declared the outbreak to be a pandemic. And, knowing Canada's scientists and technicians and industry, they were already at work on a response to those threats. They rolled up their sleeves, and working with colleagues around the world, they developed a vaccine, which is effective and, most importantly, it's safe. These developments and the testing protocols don't happen overnight. Testing, clinical trials, etc., take time, and it wasn't until about 10 days ago, in fact, October 21st, that Health Canada declared version 1 of the H1N1 vaccine to be safe and effective. October 21st. In planning for the use of vaccine doses, public health officials believed that, given the limited resources available, and given the fact that we had supplies of the vaccine in stock and that the approval had not yet been given, that the best way to plan the uptake of the vaccine was to concentrate the resources in a few large clinics where assembly line techniques could be utilized to move people through the process as quickly as possible. To that end, individual staff could distribute information sheets for completion by the patients. They could counsel and inform the patients so that they would have informed consent to the vaccinations. So this was a reasonable way to proceed, given the fact that there were vaccine dosages in stock and more were expected. This will be, as the Minister has said, the largest program of vaccination in the history of Alberta. Let's look at what was accomplished in the first week of the availability of the H1N1 after approval by Health Canada. 400,000 people vaccinated, an amazing accomplishment. That's about 1 in every 8 Albertans. Not only will those people be protected, but they will not be transmitters of the virus to others in the population. And despite what some people have said in the House, we don't have to get to 80% before we get some protection. It depends on who you're in contact with. And if you're in contact with some of those people that have already been vaccinated, you'll be protected as well by the fact that those other people have been vaccinated. Having several 100,000 doses awaiting approval for Health Canada to deploy, it was a reasonable assumption that the best way to proceed would be to vaccinate as many people as possible in the shortest period of time. But what happened to upset the original plan for vaccination were two things. One, the response was much greater than expected. Why? People listened, first of all, to the advice of the medical community to get the vaccination, to be sure. But beyond that, a few notorious but extremely rare cases where robust and healthy persons succumbed suddenly to the virus were widely reported on the front pages of our newspapers and our television and radio news. Secondly, the deliveries of the vaccine doses were not as quickly made available as originally contemplated. And in view of these two facts, unplanned limitations of supply and much increased uptake, the plan began to bog down. So, Mr. Speaker, let's calm down, put the matter in perspective. The plan, as it was originally rolled out, was a judgment made in the best interests of Albertans, based on the best predictions of response of Albertans, and based on the expected supply from the manufacturer of the vaccine. It was a plan to maximize the speed with which the vaccine could be made available and utilized as soon as it was approved by Health Canada. As I mentioned, that was only October 21st when the vaccine was declared to be safe and effective. In view of the evolving facts as we know it, our public health officials have changed their plans to prioritize the high-risk population, those with chronic conditions, such as asthma, diabetes, heart disease, pregnant women, or those with weakened immune system. But let's remember, Mr. Speaker, for most of us, the H1N1 influenza will only produce mild symptoms. What will happen now is the higher risk people will go to the front of the line. Let's realize, Mr. Speaker, that it takes time to get things right.